Thank you for the warm welcome. It's an honor to join you today at the 2025 Progress Summit. This summit's theme could not be more timely. Canada truly is at a tipping point, facing multiple overlapping crises, and healthcare being one of the most critical. Our union's healthcare members, scientists, researchers, nurses, pharmacists working across federal agencies are on the front line of that crisis. They've told me directly, our healthcare system needs more than Band-Aid solutions. It requires the kind of transformative thinking that this Progress Summit is designed to foster. Our healthcare system isn't just another service, it's progressive infrastructure that enables economic security, social mobility, and human dignity. When privatization threatens healthcare, it threatens the very foundation of progressive values that the Broadband Institute champions. For-profit healthcare doesn't reduce wait lists, it creates two-tier access based on the ability to pay. Every dollar that goes into shareholder profits is a dollar not spent on patient care. Our PIPS healthcare members are the early warning signs of outsourcing services, contracting out of professional work, and pressure to adopt private sector efficiencies that often mean cutting care that is necessary. Right here in Ontario, Premier Ford is using the classic Conservative playbook of underfunding public services like healthcare to create a deeper crisis and then presenting privatization as the only solution. But as progressive leaders, we know that crises present opportunities for bold action. That is precisely the moment for the labor movement, democratic institutions, and progressive activists such as ourselves to unite to defend our public health care. In this election, I think all Canadians should demand that every federal leader commit to increased, stable health care funding tied to the Canadian Health Act principles, pledge to implement universal pharmacare, present a concrete plan to address health care staffing shortages, take a firm stance against privatization initiatives that threaten equal access, and ensure our healthcare workers have fair compensation and working conditions. PIPS healthcare professionals are committed to the preservation and improvement. Together with our allies across the labor movement and civil society, we will defend the essential public good. The choice before us isn't between the status quo and privatization, it's between strengthening public solutions or abandoning our shared commitment to equal care for all. I'm looking forward to today's conversation about how to navigate the convergence of economic strain, staffing shortages, and privatization pressures. And the summit rightfully calls this a tipping point. Our panel is led by the moderator, Josh Bijak. He's taking he's going to be guiding this panel through a wonderful discussion. Josh was the founding Director of Development at the Broadband Institute, served as a senior advisor to NDP leader Jagmeet Singh, and now brings his considerable expertise as Executive Director of the Douglas Coldwell Foundation, and also, I hope, he is my future MP in Ottawa West Nepean. It's a privilege to share this stage with this panel of distinguished healthcare leaders who are at the forefront of protecting and strengthening our public health care system. We have President Linda Silas of the Canadian Federation of Nurses. Linda has been a tireless advocate for nurses for over 2 decades. Under her leadership, CFNU has been at the forefront of campaigns for safe staffing ratios and workplace safety. Linda's frontline nurses experience gives her unparalleled insight into the daily challenges facing our healthcare system. CFNU represents over 200,000 nurses and nursing students who form the backbone of direct patient care across Canada. We're also joined by President Tyler Downey of SEIU Healthcare. Yeah, that's right. Tyler leads one of Canada's fastest growing healthcare unions. His organization represents workers across the care continuum, from hospital staff to long-term care workers to home care providers. Tyler has been a powerful voice against the corporatization of care, particularly in the long-term care sector. SEIU Healthcare's 60,000 plus members include many of the most vulnerable and undervalued workers in our system. Finally, we are joined by President Josh Reiner of the Canadian Medical Association, Josh Reimer of the Canadian Medical Association. Dr. Reimer brings the critical physician perspective to our discussion. The CMA's advocacy work has highlighted the growing crisis in physician burnout and healthcare accessibility. Under Josh's leadership, the CMA has taken strong positions on social determinants of health and health equity. The CMA represents 70,000 physicians, residents, and medical students committed to improving Canada's healthcare system. Together, they represent the backbone of Canada's healthcare system, the professionals who deliver care, conduct research, and advocate for patients every single day. Please join me in welcoming them to the stage.
Thank you very much, Sean. Good afternoon, friends. It's so nice to be here with my family back at the Progress Summit. It's wonderful to see everyone. Thank you for joining us for the Douglas Coldwell Layton Foundation panel on defending healthcare through crisis. I think we can all agree that healthcare is something that we fought hard for, is something that we need to fight to protect, and is something we need to fight for to expand. Right now, we are facing unprecedented challenges here at home, provincially, federally, and from around the world. The constant threat of privatization and the for-profit industry is felt by everyone. The for-profit healthcare industry, in my opinion, is morally deficient. And I think that Canadians are waking up to the idea that our cherished healthcare system may not be what we believe it to be after the next few years. So here we are. There's a federal election on, and we're going to discuss how we can solve these problems. I want to thank my panelists, my friends and colleagues. These are all experts. So we're going to start with the very first question. And I'm going to read it. I'm going to read all of them. And so what we'll do here on the panel is we'll start with Josh first from the Canadian Medical Association. Then we'll go to Linda Silas from the Canadian Federation of Nurses Unions, and then to Tyler. And then we'll rotate back for the next question. So first, starting with you, Josh. Looming heavy over the Canadian consciousness is this trade war, tariffs, and the economic uncertainty that comes with it. As leaders in healthcare, how do you see these threats intersecting with your sector and the services that your members provide?
I mean, there's no question that the economy and health are deeply interlinked. And so when we're seeing these threats to the economy, when we're seeing threats to our income, we know income is the #1 determinant of health. And so whatever threatens our income also threatens our health. And so that's going to apply both to patients, but also to the system itself. So we surveyed our members, and 90% of them are deeply concerned about the cost of living impacts, the cost of pharmaceuticals, access to medication, how all of those potentially are going to be impacted by the tariffs, by this approach to trade. And on top of that, we know that Canadians' health will get worse if we have a recession. That is just something we know goes hand in hand. And then the final thing that I'm really concerned about is the cost of running a healthcare system as well, because we are also purchasing things and facing tariffs. And so when hospitals have to buy medical devices, that's going to cost more. And in the physician world, a lot of physicians, particularly family physicians, run their own businesses. Their clinics are funded by their income. And if suddenly their cost of all their supplies goes up by 25%, they have no mechanism to increase their fees. There's no mechanism to find additional income. And I worry that we're going to see more family docs leaving community family practice because they're finding it not sustainable to do that work. And that's the last thing we need. We already have 6.5 million Canadians who don't have access to a primary care provider. So I think that there are sweeping concerns to patients' well-being, the cost of the system, and also how it's going to impact the existing health human resource crisis.
could repeat everything Josh just said, but I'll add a little story. At the end of last February, the Prime Minister called the Canada-US Economic Council. SEIU was there, CMA was there, I was there, and we all flew to Toronto with about 24-hour notice with about 150 leaders across the country. But why were we there? And so many other public sector unions, it was to talk about tariffs, yes, but how the public sector, our healthcare system, is that security blanket that we cannot forget. We have to be talking about how we invest into our public healthcare system and other public services. And if our voices are not at that table, they will forget, because it is scary. You heard this morning the president of the Canadian Labour Congress saying 1 million jobs are at stake. 1 million jobs. Some areas are more at stake than others. And that, as Josh said, it is the #1 socioeconomic factor that we all look. It's about our physical, our mental health, and our families. But the security blanket is our healthcare system, and how do we keep it alive? And that's what we will continue on talking. That's what we're talking about the federal election, but that's the next question.
Yeah, so I'll start by just describing who our members are. 65,000 now, so.
250,000.
Hey, we're a local. But they're women, they're immigrants, they work across the healthcare spectrum, they're extremely dedicated, but they've got struggles. They've got like real struggles. They've got food insecurity struggles. They've got landlord-tenant issues. They've got financial stress struggles. And so, as we think about the impact that the tariffs may have on them, it's just gonna exacerbate how they're showing up to work and how they're bringing that stress into the workplace. And many of them wanna work without all of that stress, but they can't ignore it. They can't alleviate that. And so I think what we're concerned about is how much that stress contributes and impacts their ability to deliver the best care that they want to deliver. And so I think that's how it intersects with the work. But what we're thinking about is, how do we provide solutions in this moment? How do we think about the moment as a reset for our union? And so the last year and a half, we've been on a course to really redefine like our role in providing solutions. And I'll give you a quick sort of example, because I know I'll share some others throughout the panel. But we created a digital hiring hall in healthcare, the first of its kind in Canada. We've created through our SEIU Healthcare Training Center. And what that is doing, it is having a direct impact on removing predatory and exploitive agencies, private agencies, from the system. We've already seen it happening in Ontario and many different long-term care facilities that we're working with. We are redefining the way in which workforce development is being done. And we're building and we've created a unique internationally educated nurse pathway that is non-exploitive, that is easy to understand, and easy for these nurses to become registered nurses here in Canada. And so for us, the tariffs, yes, we're concerned, we're worried, but we're using the moment not to stay worried, but to think about how do we become the solution provider in this moment that we're in the reset. So that's kind of how we're thinking about it, and that's how it intersects with what's going on.
I really appreciate that, Tyler. I know that your members deal with a very particular type of stress too that can be impactful. But I thought that maybe I'd open that up for both Joss and Linda. The stress factor that your members are feeling now because of these threats, and what it's like for them living through that.
Well, I think it's across our healthcare sector, and it's not getting any better. Before, you would talk a lot about home care workers. You would talk, when I heard our past prime minister say the condition of care, the condition of work or the condition of care, I said, bravo, SEIU. That's Dr. Pat Armstrong that penned this sentence. But for the prime minister to realize that you cannot have unhealthy people take care of people. And that is for every of our field of work, but it's not getting better. Like, we have to turn this around. We really have to think of the physical and mental health of our healthcare workforce and stop giving excuses.
Yeah, I mean, there's no question we're seeing burnout at levels we've never seen in our profession, but all healthcare providers. And there's many reasons that have led to this moment, but it's still true that we're seeing people decreasing their hours, finding other positions outside of healthcare, leaving completely. And we are so dependent on our health system in Canada, as we should be, and we need to have the supports in place to be able to provide the care to others. I love what you said, because you have to be healthy to provide healthcare to other people. And I think that's something that we would all agree on, that we want to see all workers in the healthcare system with the supports that they need, because at the end of the day, we want to be that support to others. And Canadians are experiencing a lot of stress right now, a lot of suffering, a lot of anxiety about their jobs. And so if we can have that strong health system and that strong health workforce, hopefully we can be part of the solution to help other people weather this storm as well.
Yeah, Josh, let me just add. So, one example I want to just share is, like, you take a Filipino nurse who was a nurse in the Philippines doing like high quality care, decided to come to Canada to become a nurse. Many of these nurses are sitting and working, nothing wrong with PSWs, nothing wrong with being a personal support worker, but you came here to be a nurse. And so when we think about the stress levels, because their inability to become a nurse here because of all of the barriers, that's another thing. That's why, like, I'm really pushing our union to think beyond the rhetoric, think beyond look, if there's a research in the room, nothing wrong with policy papers and policy positions. We have to have that. We have to advocate that way. We have to organize. We have to do all of those things. But for me, I'm saying to our union is, like, we need to be the ones coming up with the solutions in a concrete way and designing and controlling and building and bringing people to the table, bringing government to the table, to our table, right? Bringing the employers to the table. And so I think that's what people need to see. They need to see a new approach to finding solutions that provides hope, right? And we can really tackle this occupational segregation, what we're talking internally about, is how do we tackle the occupational segregation that exists? So if you're a PSW, if you're a housekeeper in a healthcare facility, you have a chance to become a nurse. You have a chance to move through these classifications, these higher paying jobs. That's what people need to see. Leadership and hope is what's gonna get us over the stress levels that people are facing.
I think there's a really interesting point that you've all brought up here, and there's a responsibility to provide health care to people, but there's also a responsibility by the government to take care of healthcare workers, and that's clearly lacking. And certainly that is a threat to the entire system itself. So let's move on. We'll go to the second question. We'll start this time with Linda. So let's go. On the top of the top of this crisis in global trade, we're above and beyond that. We're also in the middle now of a federal election. In fact, yesterday was the halfway point. I know that. What is the one priority you're looking to hear federal leaders speak to, and have any of them done so already?
Well, last week, you can ask my team, I was quite peed off. CBC talked about the priorities of the federal election, and healthcare wasn't there. Now the healthcare is here. They're nodding. They send me a note on Tuesday. They put healthcare. And it is discussing healthcare. It's discussing one of our key public program. For us, our number one ask is patient safety. And we're asking the federal candidates to look at, is it a patient safety guarantee, a patient safety act that would specify to patients, seniors in long-term care, you will have 4.1 hours of care guaranteed. You will have a place in a long-term care facility if you need it near your home. You will have home care if you need it. And if you're in the hospital, you're going to have proper nursing care. And that's safe staffing, that's nurse-patient ratios. So the federal government cannot mandate a province or territory to have nurse-patient ratios, for example. But they give the federal transfer money, the Canada Health Transfer. They can demand, show me your health human resource plan. Show me, do you know how many nurses you need in 5 years? Do you know how many doctors you need in 5 years? Do you know why they're leaving, why they're not taking full-time jobs? In nursing, only 56% of our nursing population are into full-time jobs. A full-time job in nursing is 37 hours a week. I do not remember the last time I only worked 37 hours in a week. Like, it is crazy what's happening in a workforce where you're not happy. So when you're not happy, when you're scared to get hurt, you're scared to make a mistake, you do not want to be there 37 hours a week. And that's the switch. So our number one ask is patient safety.
Yeah, that's great. I agree with that, Linda.
Oh, you say that again, Tyler, please.
I agree with that, Linda. Yes.
Thank you, thank you.
I agree with a lot of things you do, Linda.
Oh, public service announcements. CFNU just came out with a research paper
read
and
it.
policy on
Yes.
internationally
I
educated
read it. I have it in
nurses.
my bag in my hotel room. Yes. I'm watching you very closely. For me on that question, you know, there's a couple things, but I'll highlight one. Whoever turns to be government, you know, on April 29th here, really needs to see care work as nation-building work, and invest accordingly in like a federal, nationally organized and arranged workforce strategy. It's missing. It's piecemeal right now. It's fragmented. And I'll give you one example. In Ontario, you know, the last few years, the Ontario government has been spending billions of dollars in new long-term care facilities and building new long-term care facilities that will come online in the next few years. We've been meeting with some of those employers, and the number one thing they tell us through our training center work is, you know, Tyler, we've got a 500-bed nursing home that we have to build for 2026, 2027. Where the hell am I going to find the people and the support workers and the nurses when I can't even staff the existing nursing home that we have down the street? And so without a workforce development strategy, I'm not talking about these announcements where they go and talk about, we're going to add 15,000 more beds. All right, cool, that's good. But who the hell is going to staff it, right? Who's going to care for these the residents and the seniors? And so for us, that's one of the things that we haven't really heard much from the federal candidates, and we're going to really push them to come up with something. The other thing I'm going to say is, you know, shame on this liberal government, and folks in the room are liberals, whatever, but they made a commitment to home care workers across this country that they were going to help them begin to save for their retirement. If you don't know, many home care workers can't afford to save anything for retirement, right? They're living literally paycheck to paycheck, and home care is the fastest growing part of our healthcare system. More and more people are going to depend on home care services, and you've got workers who can't afford to, you know, retire. My aunt is 73 now, and she's still working as a PSW in home care because she can't afford to retire because she lives in Toronto, right? And so this government committed a bunch of resources and money. We applied, we almost got over the line, then they called the election. And so now we're at a standstill, and that would have impacted about 12,000 home care workers, probably just in Ontario alone, that don't have access to any sort of workplace pension plan. They would have got them on the track to begin to start to save. And so it's those type of things that I want to hear from whoever forms government afterwards.
Oh, it's your turn, Joss. Yeah. All right, what would you like?
More nurses.
Yeah, that's what I was going to say for sure. Yeah, I mean, I do want more nurses and more personal service workers and all health human resources. But what we've been hearing during this election has been a focus entirely on the economy. And that's understandable because we are experiencing a new world order that we haven't seen in decades. And the stresses on income, this is very real. But let's be clear that you cannot have a healthy economy without healthy people. You cannot contribute to the economy if you do not have health. And so what I want to hear from every political party is how they are going to strengthen our health system to ensure that Canadians are given the tools they need to be healthy in order to support the economy, in order to thrive in Canada, because these pressures that we're facing are not going away anytime soon, and we need to have this health system to help mitigate some of that. It's not going to get rid of it, but it is important to mitigate. And when we've been talking to Canadians, what we hear over and over again is that access to care is their #1 concern. Access to primary care, emergency care, waiting for specialist procedures, diagnostic tests, and that's what I want to hear from every party. And so far there's been some talk about pharmacare, dental care, a little bit about broader commitments to public health care. These are all great. I'm not pushing against any of those, but I want to hear more specifics about how we're going to improve access, how are we going to address these shortages of health human resources, how are we going to get the 6.5 million Canadians who don't have a primary care provider into a team-based primary care practice where they can get access to the type of provider they need to keep them out of the hospital. Hopefully, so they don't end up needing home care, if we can keep them healthy and self-sustaining for longer by giving them preventative care. These are the commitments I want to hear from every political party. And so far, we've heard a few nods to parts of the health system, but nothing fulsome, nothing with depth about how we're going to make this happen.
I would agree with you on that. And to Tyler's point too, you do hear a lot about infrastructure. That seems to be a word that gets floated around without actually digging into the details of it. And I know that we do have a labor deficit and a skills deficit, and we'll talk about that a bit later. Is there anything specifically on the topic, though, of training that we could add as an ask for federal leaders right now? Oh, no, this is to the panel. To the panel. Any thoughts on that, Tyler or Linda or Joss?
Yeah, I mean, I would say on training, let's not make it piecemeal. Let's really think about how we invest in training, because I mean, training is one thing, but it's retention, right? And what are the ways in which we're going to retain these workers that are getting trained? And you know, Ontario is a good example. They had a bunch of incentives, and you know what we were finding out when we did our surveys internally at the union was like, if you were PSW, you got, you know, I don't know what it was, $10,000 to sign up as a PSW. You stay there for 6 months, and what happened? After 6 months, they left, right? More than half of the PSWs end up leaving. Right? And so you spent all of this money and effort in these incentives. And look, nothing wrong with incentives if you need to get people in the door, and great. But it was just like a wild, wild west, and let's throw some money at the issue without really thinking about an overall strategy to retain these folks over time. And so I think that's what like we would be like looking for, Josh, from a training perspective.
I think for us, the retention is a big issue. There's even a federal government retention toolkit for nurses, and we have to continue on working with it. But I want to start at the base. Our students are struggling, and it is to a point that it's affecting their physical and mental health. What is it? It's about 40% of nurses under 30 years old want to leave. Under 30. Like want to leave because of what they're going through. So why wouldn't a progressive politician announce free education for everyone entering the healthcare field? Why for the next 5 years? Why wouldn't they do that? That is simple. Why wouldn't we guarantee pension plan for anybody working in home care if you work 0.8 of a full-time, similar as it is in the hospital sector? If you're a permanent employee in the hospital sector, you have to have a pension plan. The employee can't say, no, please give me 10% more of my salary. It is towards your future. So why aren't we doing that in every sector of healthcare? Those are announcements that would be very progressive, but they're not the building where they can take their picture when they take the shovel, take the picture when they open the door and cut the ribbon. We have to think of tomorrow. You know, when the elder spoke this morning, it was not the elder, sorry, it was the rap band, way past my age band there, but the rappers that were here, they said we have to think of 7 generations. We don't do that in Canada. We think about April 28th. And then is it going to be April 28th in 2 years if we have a minority government, or April 28th in 4 years if we have a majority? Stupid.
I don't know how to follow that.
That's good.
No, so the question was about training, and Health Canada released a report saying we are short 23,000 family physicians in Canada. We cannot train our way out of that. We graduate 1,700 family physicians a year in this whole country. And so even if, and half of them don't do comprehensive family practice. So even if that whole half did comprehensive, nobody retires, nobody gets sick, we're still like decades away from being able to train our way out of that. And the average family doctor has 10 years of university education. So this needs to be part of the solution. There's no question. We have to increase class sizes of nurses, of physician assistants, of respiratory therapists, of medical school classes, all of them. But that's also, thankfully, thinking further into the future, not just to April 28th. But in the meantime, I also want to see investments in team-based care. I want to see us looking at administrative burden and getting rid of a lot of the paperwork that we all spend so much time doing. I want to see, the federal government could be funding AI to help us do some of that paperwork. We always talk about how healthcare is provincial, but the federal government has many opportunities to intervene. They could fund things like AI. They could fund training spots. We don't pay a lot of our teachers in medicine. We just sort of expect that the doctor who works in the clinic will take the students on for free and find the computer and the extra clinic room, and they could fund increased capacity. So I want to see us thinking in the short and long term at the same time, and I want the federal government to be part of that solution because they are the biggest funder of healthcare in the country.
Yeah, I think there's a tremendous opportunity there. Training, retention for sure, and then incentivizing, absolutely. And there is a responsibility, again, that the federal government, there's a role for the federal government here to play. And I think that it's vitally important that we recognize that and that we do have a deficit in that regard. So let's move on to the next question. These are really good. One of the last components of the Confidence and Supply Agreement was the establishment of a national framework for pharmacare. This was passed into law with Bill C-64, but without uptake from the provinces and territories, this hard-fought victory may not materially improve the lives of everyday Canadians to its fullest. What's next for pharmacare, and what role will your organization or association, union, play in the process? This one starts with Tyler.
Yeah, so for us, one, just quickly answer the question directly and pivot a bit. We're going to continue to support the pharmacare efforts as we always have, through whatever means we can lend our support to the campaign. Legislation is one thing, implementation is another. And so for us, we, again, are thinking about let's not wait for some other person to go and figure that out. How do we internally as a union use our expertise and our resources to provide solutions? There's 2 groups of workers that are really important for us. I talked about home care already. These are folks who don't have access to nice, healthy health benefit plans, right? Many of them, there's one circle of care, we literally just negotiated their first ever drug plan, and they've been in business for 30 years. And many of these workers have worked there for 30 years with no drug coverage, no health benefits, no massage, and things that we take for granted, right? And so you see that right across the home care spectrum in these agencies. There is a growing population of healthcare workers who are resorting to the gig type work. And so why we created the hiring hall was to combat that. And what we've done is we've built in our own health benefits within that. And so if you're a worker that is looking for those extra shifts and moving around in that gig type of economy, you can come onto the SEIU platform and get benefits and get pension, right? And so normal agencies wouldn't do that. And so for us, it's about, yeah, there's a problem and we need to continue to advance pharmacare, but it's like, we're not gonna wait. You know, we can't wait because these people are gonna keep suffering and suffering. And you know, politicians take forever to do shit. And so it's like, let's figure out our own solutions that we can control, we can define, and we can provide access to people that really need it.
So we were really happy to see pharmacare come through. In fact, I spoke at the Senate committee supporting passing the pharmacare bill. And medication is such a core part of healthcare. It was always intended to be part of our healthcare system. And it's interesting that if you're in the hospital, it's covered. But the second you get discharged, suddenly you're on your own. And that's probably an unintended design flaw in our system. But it is what it is, and as physicians, we have patients all the time who can't afford their medications. We've surveyed our members, and 70% of them said that they have to be actively thinking about whether or not people can afford what they're prescribing. Honestly, it's probably closer to 100% of people who would have to really think about that, because it's a reality. People skip doses, they cut them in half, they don't take their medications at all because they can't afford them. And so they go on to suffer the consequences of not having their health condition managed, even though the physician care was covered. But the physician care without the medication is really not complete. I work at Women's Hospital in Winnipeg, and so the contraception coverage was really relevant to my practice. I also worked at a clinic called Northern Connection Clinic, which was mostly Indigenous women who go back and forth between the north and the city. And so these are the people who face the highest barriers to care. Some of them have coverage through First Nations Inuit Health Branch. Many of them didn't. They don't have status. And so I can't even tell you a story because I have too many stories of people who couldn't afford their contraception. They can't afford the $100 to get an IUD. And so they're left with a choice of either getting a tubal ligation, so going in and getting an invasive surgery that's going to cost the system thousands of dollars, puts them at risk of bleeding, puts them at risk of infection. They're going to have a hospital stay, or taking a risk and having an unintended pregnancy, which is going to cost them personally much more. And this was something I saw all the time, still see all the time, when people are making these difficult choices in their life about whether they're going to buy food that day or get their birth control. Those are not choices we want Canadians to have to make. And that's why we spoke at the Senate committee, and that's why we will keep pushing for this to be a reality for Canadians. Medication is a core part of healthcare. It's not the only thing. There's so many other things that keep us healthy, but it is a core part of healthcare. And so we want to make sure that as physicians, when we prescribe something, that every patient's going to be able to go and get that medication.
Thank you.
And it's exactly what Josh just said. It's an extension of our healthcare system. You do not finish after your doctor's visit or your nurse practitioner's visit or your ER's visit if there's a prescription, and it is what is medically necessary. You know, people often ask me, Linda, when you lobby for pharmacare, is it going to be everything on the list? I said, no, that's not my decision to make one way or another, but it is what is medically necessary should be the extension. The reality is that if you have nothing, you need a real nice doctor that will give you a sample. Like, that is not how our system should work. Our system is not based on our credit card, and our system is not based on connections either. And that's what's happening with so many families. Now, for pharmacare, for the nurses' unions being a 30-year lobby campaign, on and on and on. And we came very close. 2003, 2004, remember Paul Martin, we have an accord to change for the next generation. And then, whoops, we went down to 2015, 2018, 19. We were sure we were going to get a national pharmacare program. Then the pandemic hit. That should have convinced a lot more that we needed access to medically necessary prescription drugs. And now we have Bill C-64, which hopefully will be the opening of the door and making politicians realize we need to finance a national pharmacare program so we save money at the end of the line. Because when we talk about primary health care, you know, it's this term that Canadians don't understand. What is primary health care? Primary health care is to have a healthcare provider helping you to stay healthy, helping you to navigate the system if you need to enter the system. Primary health care means having access to your prescription drugs.
Yeah, thank you all very much. You know, it really is a shame that people are having to decide between paying for groceries, their bills, or their medication. And that was not the plan. I mean, when we were talking about a pharmacare program, we were talking about solving this problem, and somehow it's been whittled down over the last few years. I sincerely hope that your associations, your unions, and your members will help advocate for a truly universal pharmacare system to solve this problem so people aren't suffering. I'm sure we can count on the three of you and your unions and organizations. So thank you for making that push for us, because we've come a way. We've gotten some of it done, but we're far from having a complete system. Okay, so let's move on to this next question. We can always come back to that too, or just add on to it. In discussions about the crisis in access to healthcare, accreditation of internationally educated healthcare workers is often brought up as a solution, but progress has been slow. What are the barriers from your perspective, and what should the federal and provincial governments be doing to address them? This time we'll start with you, Joss.
So in Canada, a huge proportion of our physician workforce are trained outside of Canada. Some of them are Canadians who went outside of Canada to go to medical school. Some are people who have moved to Canada, already have completed their training at home. But they make up a major part of our workforce, and in some parts of the country, they make up the majority of the physician workforce. So this is not a small issue for us when we talk about physicians in Canada. It's really important that we make sure that we're helping people who want to contribute to our health system to do so in a way that is safe, but also efficient. So we don't want red tape for the sake of red tape. We do want to make sure people have the training, because Canadians deserve to know that they're going to get a physician who's got the standard of education that we expect. But we don't want red tape for the sake of red tape. And so I want to see all of the colleges across the country being supported to be able to do assessments of people. And it's one thing to come up with a program for the standard stuff. And that they're doing quite well. If you come from certain countries, if we know your medical school, we can get that through fairly quickly. But we need a lot more individual assessments of people who maybe, you think about, maybe there's a family doctor, but they've never treated children. We don't want to not have them in the health system, but you also don't want to just say, you're good, go ahead, do family medicine. So we need someone who has the time to assess that individual to say, great, well, maybe you're really good at minor procedures, and you can come work in a minor procedure clinic doing the lumps and bumps and stuff that we all need as well. But that takes time. And so the challenge is that it's not even so much that we're fragmented, but that there is individual assessment that needs to be done. When it comes to the US, I'd say we have a window of opportunity right now, though, because the training in the US is very similar to Canada, and we have 4 provinces that are fast-tracking US physicians into licensure here, but we need to get this across the board in all of Canada, because we are getting more interest from US physicians than ever before. The Medical Council of Canada has seen almost a 600% increase in people signing up for their website about interest to come to Canada, like 600%. And so this is a window that is not going to be open forever, and so we want to make sure that, you know, if there's I hesitate to say silver lining because it's because of such devastating cuts and things going on, but if there's a silver lining, it might be that Canada gets to benefit from a wealth of medical and scientific expertise that of people who want to be part of our system here, who value working in a place where politicians and insurance companies don't dictate medical practice. So I want to see the federal government fast-tracking visas, eliminating some of the immigration steps. Like we shouldn't have to do labor market evaluations to prove that we have a shortage of physicians. Health Canada already did that for us. Their report said we're short. And so we're asking the federal government to take steps on the immigration side, and then all the provinces and territories to take steps on the licensure side to help people who want to be in the system contribute.
You know, I could easily just say ditto, but it is the same thing. All healthcare professionals are asking for standardization in how they enter the country. It does not make sense that my home province, New Brunswick, has a different system than Manitoba. It doesn't make sense that when I move from New Brunswick, you know where New Brunswick is, to Ontario, the College of Nurses of Ontario asked me for my passport. It doesn't make sense that a nurse who graduated in England has to pass an English proficiency test. Like, didn't they invent, I'm French, I know, but didn't they invent the English language? It just, some things are just a nonsense. And does it make sense that they have to pass the English test every X numbers of months, or I think it's about every 2 years, and pay for it? We have to give them a guarantee of, you're coming in, we already checked at your education, we already checked your language, and there's a job waiting for you, and we will onboard you professionally and culturally. I'm from New Brunswick. When I went back during the pandemic, there's big fish industry, and I was so proud of our little villages. You go in a grocery store in Cap-Pelé, which is a little village. There's a big Mexican section in a little village grocery store. And I thought, what's that? Like, I hardly see that in Ottawa. And it's because they have a lot of Mexican workers coming to help the fishermen. And they want to culturally welcome them. We need to do that in every area of the country when we're talking about internationally educated health professionals.
Yeah, so, I mean, I think I lifted it up a little bit earlier, but some of the things that we learned very early on in our exploration of the internationally educated nurse phenomenon that was occurring over the last few years, some things stood out. So there's about, I think, 3 things that really stood out to us. 1, it was time. 2, it was about access to the right information, and 3, it was finances. And so you've got a situation in healthcare in Ontario for sure, and probably right across the country, where they decide to come to Canada with the hopes that they become nurses. So they're paying someone, and I'll use Philippines because I was just there in February. They're paying someone to, you know, expedite and figure out their immigration. You know, some numbers I heard, $15,000, $20,000, $30,000. Then they got to get on the plane, they got to get here, they got to get to their job. When they get on the job now, they're left to fend for themselves. Literally, like these employers are like, all right, thanks for coming, but that immigration stuff and that nurse pathway stuff, forget about it. Go and access the government programs. There's very little supports for these individuals. And so they don't have the time to go because they got to work. Right? They got to work, they got to feed themselves, you know, they got to do the day-to-day, they got to pay rent. So they don't have access to the right information, and they don't have the finances to go and like do all the licensing and the preparations and all of those type of things. And so we have this situation in our union where the 5,000 or so nurses that were from international spaces, we asked them, we said, if you had the time, the finances, and the access to the information, would you pursue becoming a nurse? And they said, absolutely, yes. 60% said, yeah, I would do it right in a heartbeat. So we created the Nurse Pathway Program. Again, we're not waiting for folks to come with the solutions. We decided on our own, once we uncovered it as a union, we said, okay, well, let's go and figure out how to build a pathway that is non-exploitive, that provides all the resources to the nurse. That's why I went to the Philippines in February. We built a pipeline now so that it's non-exploitive, so that they don't have to worry and have all this stress when they come to Canada. We have an integration module that helps them integrate into the workplace, because it's not just about immigration, it's about integration too. And so while they're on the job, we help them get to the point where they can go and take the exam and the nursing exam. And it's all handled by, we have a case manager within the training center that does all of the work for them. So they just got to show up to work, they got to just study and go take the exam. So all of the stress and the pain points that they said they experienced, we've removed all of that with our training center work. And so that's the type of stuff that I think we just need to do more of and have real solutions. And that's the type of stuff that government should be funding more of, those innovative solutions. So, yeah.
And there's one thing we did not mention. We have to do ethical recruitment too. You know, Philippine, when you mentioned it, Philippine used to be a really exporting nurses. They get to a point now that they're into a borderline shortage. There's some countries that really need their nurses. Most countries really need their nurses and their doctors and ever, but we have to be ethical about how we do it. How do we give back to that country when we take their resources? And that's part of a federal government policy.
I also want to add that for the people who are already here, I think the example you gave, it's really hard when you're trying to earn a living, but you can't earn a living in your area of training and trying to afford these exams. Because the exams cost thousands of dollars, and we can fine tune about when the exams are appropriate or not appropriate, but sometimes there's going to have to be exams. But if we could find funding to pay for people to do these exams, they are people who might be ready to go, but when you're just trying to make ends meet because you can't actually work in the area you've trained in, that a couple $1,000s, that's a pretty big barrier. And just think of, that's not a lot for the government to spend, but it's a lot for an individual who can't earn a living in their area of specialty.
Yeah, and let me just add this. Think about this. So just in our union alone, we identified 5,000 internationally educated nurses that aren't practicing as nurses. They're PSWs, they're other classifications. So 5,000 of them in our union. And we say we have a nursing shortage, we have a nursing crisis. And we were telling the employers, like, yeah, but if you put some money in, you can get 150, 200 nurses to fill those vacancies right away. And that's what we've been doing with these employers the last year. That's why we created our own program. We're like, well, if you're not gonna do it, government's not gonna do it, we'll do it, and then we'll bring you along the ride with us. And that's what's happening. And so it's just interesting that we have the people that want to be nurses, and we keep saying, oh, there's a nursing shortage. Yeah, there might be, but you got people right here that want to be nurses that just can't be. It's kind of ridiculous, to be honest with you.
You know what, Tyler, I completely agree with you. It is ridiculous. It's extremely frustrating to think that barriers have been built to prevent us from finding these solutions. The fact that workers can't move from one province to another without these barriers being there, the fact that people who are skilled are coming here to our country and then finding new barriers to be able to perform the things that they have been trained in is really horrible. It seems like only political will is going to fix this, and there's a big difference between gaining power and having political will, and I think that's something we should all remember. So we're down to the last question here for the panel. The time has flown by, so this one's going to go to Linda first as our last question. So we're in the middle of a federal election. We have many concerns about what's happening south of the border with their new government. Fears of US-style healthcare and privatization are at an all-time high. What is your message to Canadians who are worried about the future of public health care in this country and the threat of privatization?
Investing into our public healthcare system is investing into our economy. It is not an expense, it's an investment.
Me? Okay. Yeah, I would say this. there is hope. We have to continue to organize across communities to push back against the deterioration of our public system. So there is hope. That's what I would say is like, let's just maintain our hope. But we also, and I'm going to speak from our union's perspective, and this is what I'm driving our union to just keep pushing, we also have real solutions that are worker-centered solutions, and we've got to continue to put those forward and work with the industry to put those forward. We are tackling the private agency issue. And so the stats on that to share with the group here, when we started about a year ago at our first nursing home, we were able to eliminate almost 100% of the private agencies in that nursing home and replace it with our union solution. The system is saving 20 to 28% off the top, right? Because there's no profit. It's about workers showing up that are well-trained, well-equipped to do the work, and that helps the whole system, continuity of care and everything. So that's one. Workforce training is important. We're doing some work with employers right now. We're building labor management agreements across the spectrum. The IEN work that we had talked about is good. Last week, we just finished the final legal stuff on, we acquired a career college, and so we're gonna be redefining how PSW training is done, and we're gonna get into the PSW training business because we believe we can influence it to make sure that it works for the sector, right? We're not waiting. And so what I would say to Canadians is there's hope if we begin to reimagine how we find solutions together. Not wait for that other person, especially if you're in a position of power in the unions. I'll just talk to the unions. If you're in a position of power in the unions, I'm gonna invite you to really think differently and reimagine our space in the healthcare system. We have the ability to reshape and redefine in this moment together. And so I think that's the type of thing I think Canadians want to see. They want to see more innovation. They want to see more collaboration. They want to see different types of ways of delivering care that isn't profit-driven. It's about providing care for the people that need it, when they need it, and providing good quality union-paying jobs. And that's, I think, the message for Canadians.
So last year, the CMA released a new policy or an updated policy on public and private healthcare in Canada. And to create it, we actually talked to over 10,000 Canadians. We did a review of the literature and we did a jurisdictional scan of other countries. And what I would say is that the loudest message that came forward from Canadians was that access to healthcare was their #1 concern and that access should not be impacted by your ability to pay. That was clear from Canadians. The second thing that came through was that we want efficient decisions being made in the healthcare system. And when we looked at the literature, broadly speaking, and there's lots of gaps, lots of pieces of information that we don't yet have, but broadly speaking, we found that privately run healthcare services tended to be more expensive and tended to have worse health outcomes. And so there's already lots of private service in the healthcare system. Some of it's privately funded, some of it's publicly funded but privately run. That already exists, that's already here. But what I want to see when any government's considering how they're going to fill gaps, that they're trying to do it in an efficient way and actually looking at the literature to say, what is the most efficient way that we can address this issue? And instead of just filling it with something that is going to instead hurt the rest of the system, trying to build something better. Because what we sometimes see is a desire to quickly address a gap by putting in a private company, knowing that it's just going to pull resources out of the public sector because there are not enough physicians, nurses, respiratory therapists, the home care worker. We don't have enough. And so they are the same people, whether it's in the private system or the public system, it's the same workers. So I don't want to see us moving gaps. I want to see us really building solutions to fill the gaps. And that means being more creative than just hiring a company to come in without assessing how efficient it is, without assessing how the costs are going to impact things, and without assessing how it's going to impact the public system.
I want to thank all of you. It would be I guess, if our politicians and our government more closely to the wise counsel that each of it sounds to me like there are solutions, one people in leadership roles listening, and then we are in the midst of a crisis. We do have hope that that we can fix many. It is worrisome as across the country, provincial, away at our public health care system. It's been happening for many years. It's unfortunate. The undermining of our system is leaving devastation. That said, I did have a question from the audience. We're not going to, but I am going to give it to you backstage, and if you want to answer the question, then please do so. Important too, as we walk away from this conversation, to consider when we talk about private healthcare, we're also talking about profit healthcare, and all of us, the takeaway here should really be what that when someone says that we need healthcare, because that is as a country decided not to do. So with that said, thank you so much on behalf of the Layton Foundation, our thousands of members, and our union partners across the country. Thank you so much for being here. Please continue the conversation side often for new research. I'm with many of you in the future. Tyler Downey, Healthcare, thank you so much. Linda Silas from the Canadian Federation of Nurses Unions, thank you so much for being here. And Joss Reimer from the Canadian Medical Association, thank you so much. We are very grateful for all of your wise counsel, wisdom, and advice on these matters. Thank you all, and thank you to the Broadband Institute and the staff for convening all of us here today. Congratulations, thank you.